Hello, my good and wonderful people. You're welcome to the channel. So today I have Senator Abaribe throws shade at President Buhari and his people. A public figure has said that they should stop lying to President Buhari. And then the third one is Nigeria acquires Keke Marwa ambulance. Okay, so it's quite funny that that is all Nigeria can actually do right now. Some other countries are acquiring ambulances. In fact, the very developed countries like Germany are acquiring the what's it called? The flying hospital, Airbus plane, like Airbus hospital. Okay, so they call it the flying hospital. And then all Nigeria can do is to acquire a Keke Marwa ambulance for COVID-19. And to think that this same Keke Marwa was banned in Lagos and then it is now being revamped to be used as an ambulance in a particular state in Nigeria is a source of laughter. Actually, it's funny, but it's not funny. I'm gonna let you guys watch these videos in a bit, alright? But before then, I want to please encourage you to support the growth of this channel by clicking the subscribe button, okay? And also turning on the notification bell so that every time I drop a video on this channel, you will get notified. Thank you so much for doing that. Please watch the videos.
What is facing us today is like a lottery. And once you're a human being, you have purchased that lottery. And so nobody is exempt. And now it is a matter that can reach anybody, high or low, rich or poor. And therefore, it presents us in the midst of all the difficulties with opportunities which we can now harness. Since nobody can jump on a plane and run away to be treated elsewhere, everybody will now look into the health sector of Nigeria and every other thing within our country. It is obvious to each and every one of us today that the solutions of our problems, we now have to find it ourselves. That means it gives us that unique opportunity to be able to actually think inwards. And so, while we commiserate with those who have unfortunately been victims of this pandemic, we also say that this gives us a new vista that we can use to be able to deal with it. And like we have seen, those areas, either in health or in agriculture or in our industrial sector, this is now the time for us to actually resolve the issues that we have been running away from all this while. My dear colleagues, what the people we need to commend are Nigerians. Nigerians have been so patient with us. The pandemic came from outside. That means it is the privileged ones who were able to come. And everyone is suffering today. And yet we continue to ask for more sacrifice from them. And they are willing and they are able to give it. And so I commend Nigerians, just like we have said here in the second, is it the second or the third resolution? And we said to Nigerians, please tarry a little while so that we can get to the bottom of this and we will come out to have a better country. As we go ahead Mr. President, distinguished colleagues, the times also call for sacrifice. And that means that we will be taxed. Sacrifice in terms of giving ourselves, giving our resources, giving our intellect, and giving everything that we have to be able to confront this pandemic. And as we do so, I also urge that each and every one of us will do his or her utmost best to be able to help us to deal with the problems that have come with this disease. I so submit.
Receiving the 14 tricycle ambulances in Benin City, Governor Obaseki commended the Office of the Sustainable Development Goals in the presidency for the gesture, which he said is the third in the series of donations to the state. He said the donations is coming at the time in assisting the state government to curtail the spread of COVID-19 pandemic.
A donation like this is very, very important because it goes to the heart of the reforms that we're undertaking in the healthcare system of Edo State. This donation is going to help strengthen our basic healthcare system, and that is what is priority for us. I'm very glad that today we're taking delivery of another set of ambulances that will help these primary healthcare centers be able to reach out and transport citizens in those communities or in nearby communities to these centers.
The state governor stressed that his administration has already refurbished 30 primary health care centers, adding that 30 others are undergoing refurbishment. He assured that by the end of this year, his administration will focus on strengthening the healthcare system in the state, will refurbish 70 primary healthcare centers with constant power, security, water and other equipment to make it effective.
As at today, we have refurbished in excess of 30 of these centers, and we are currently refurbishing another 30. By the end of this year, our plan is that we'll have refurbished about 70 of these healthcare centers. And refurbishing means that they have 24/7 electricity, they have well-trained staff, they have water, and they have the computer systems for us to get information on everybody that comes into that center, so that we have a history of the people that are being attended to, we understand the nature of their ailments, and then we can now give them further treatment.
According to the governor, the Office of Sustainable Development Goals in the presidency is committed to promoting quality healthcare delivery in the state, emphasizing that a total of 18 tricycle ambulances have been distributed in the past and currently in use in various communities in the 18 local government areas of the state. The handover of the 14 tricycle ambulances is the third in its series since Governor Obaseki took over the mantle of leadership in Edo State. Patience Osaugiwa reporting.
Who exactly is lying to the president? Who? The president has announced the easing of the lockdown on the strength of a lie. Who is lying to the president? We've been locked down now for 5 weeks. Prior to the lockdown, they made us a commitment of testing 1,500 persons every day. 1,500 persons times 14 days is 21,000. Times 4 weeks is 42,000. How then can the committee tell us that they have tested only slightly above 10,000? Today we're close to 2,000 persons who have tested positive to the virus. If we use the strength of 10,000 total already tested and 2,000 already infected, that places us at 20% infection. That's higher than every other country. Research findings are based on percentage. Who is lying to the president? Because on the strength of a lie, he has approved an ease, and he has also approved an increase in the number of people to be tested daily to 2,500. If they could not accomplish 1,500, then how are they able to achieve 2,500 a day? The nurses and doctors and all health workers are working extremely hard, breaking themselves into pieces just to save lives. And a few people are sitting in the comfort of an air-conditioned room and reaching agreements that empowers only their pockets. Why make a mess of people's effort? Why? You know, sometimes when I sit down and I think of some of the things that people sit in committees and come up with, I wonder what runs in their veins. Blood or water? Because they react like people who don't feel the pains of others. You have moved responsibility from yourself and you have hung it on the neck of the common masses. The same people that you are supposed to be protecting. During the lockdown, a lot of the poor were on the streets. Why? Because your palliative did not get to them. So they were out there struggling to see how they can feed off the food that you hold at them. So the palliatives didn't get there. No one is empowered to carry out research. So research isn't going on. Nothing is going on. And now you are throwing people back in the streets. A street that you haven't fumigated, you haven't cleaned up, but you have told us that this virus is airborne and can stay airborne for 8 hours. I don't understand. Do you even assume that everyone is stupid? Let us take, for instance, Lagos State. With no traffic during the lockdown, they could not trace people who had contact with those who had tested positive to the virus. They couldn't trace them. So imagine now, with traffic, how they will trace anyone. And if someone needs help deliberately, how will the NCDC get to the person? I don't understand. Do we want to end up like Ghana, who lifted their lockdown prematurely and ended up with all the casualties that they have? Can we handle that casualty? Someone is lying to the president, and that person needs to stop. The president cannot be allowed to reach decisions on the strength of a lie. And Nigerians cannot live with this lie.
So those are the videos, guys. Please feel free to drop your own thoughts, all right, in the comment section below, especially with regards to this Keke Marwa ambulance that has been acquired by Nigeria at the state. Okay, I'd like to hear from you guys and what you think about it in the comment section below. And like I earlier said, please support the growth of the channel by subscribing to the channel and also turning on the notification bell. Like and please share this video, and thank you so very much for watching. Bye bye.